In this video from Steve from OET Online, our premium preparation provider, he's going through the clinical communication criteria for speaking. He'll focus on things like giving empathy and giving and gathering information, which are part of those communication criteria.
All right, well, let's get started, everyone. So a bit of an overview of the speaking test to make sure that everyone is clear what it is. Perhaps it's your first time to do this exam and you really don't know what to experience. So what first question is, who will do your interview? And the answer to that is it's an interlocutor. So it's not an assessor or an examiner, and it's certainly not a real patient. It's someone who is just facilitating the communication and taking on the role of the patient. Next question, how long does the whole speaking test take? Well, I'd say approximately 20 minutes in total. So how do we get to 20 minutes? Well, let's look at the procedure, everyone. There is a greeting and a warm-up, which is not assessed. So just sharing names, a few questions about perhaps why you chose to be a health professional or what you most like about your work as a health professional. That's just to warm up, get used to the voice of the interlocutor, just build that initial relationship. And then after that, there are profession-specific role plays, which are assessed. The next question, how long do you have to prepare? Well, I think many people, if you've done any review, you probably know that it's 3 minutes per role play. You can have your pen in hand during that time, and you can make notes on your role play card. How many role plays will you do? 2. How long will each role play last? 5 minutes. Sometimes may go a little bit longer, but on average about 5 minutes. Okay, any questions so far from the audience? Any questions at all about the overview of the exam? And of course, in each role play, you will take your professional role, whether it be a nurse, a doctor, a pharmacist, a dentist, whatever your profession is, you'll take the professional role for both role play tasks, and the interlocutor will take the patient role. All right, if you don't have any questions, just type in AG. AG means all good. Just type that in. Hello to Sharon, who's just joined us from Kuwait as well. Okay, let's look at the assessment criteria. What do you need to do in order to get a B grade? Well, there's 2 categories of criteria. The first category is the linguistic criteria. That includes intelligibility. Now, intelligibility means your pronunciation. As long as it's clear and easily understood, then you'll be meeting the exam requirements. Of course, there's lots of medical words which can be difficult to pronounce. So having an awareness of correct pronunciation in your subject area is very useful. The next category is fluency. Now that means you should not speak too quickly, nor should you speak too slowly. If there are a lot of hesitations in your speech, a lot of ums and ahs, for example, based on the symptoms you have shown me, it seems you are suffering from a condition. Now, all that repeated hesitation mid-sentence is not good. So you need to be able to speak smoothly with minimal hesitations. It doesn't have to be too quick though, because you're educating your patient. So a nice, even speed is what you should be looking for. The next category is appropriateness of language. Now, in terms of this OET speaking exam, that means If you are talking about a medical condition to a patient, you don't want to use too much technical jargon. You should be using language that your patient will understand. And you've got to get a nice balance between that right degree of formality. You can build rapport, you can be friendly, you don't have to be overly formal when you're speaking, because you are building that relationship. But you do need to be aware that too much technical jargon may confuse the patient, so you need to be able to use language the patient understands. The last criteria under linguistic category is resources of grammar and expression. So grammar, sentence structure, verb use, all the little details of the language, that's all assessed. Expression relates to your vocabulary as well. So that's the linguistic criteria. In terms of the communication criteria, now this is OET 2.0, which was introduced in August 2018. They brought in this great new criteria which assesses not just your linguistic skills, but also your ability to communicate in a medical context. So building that relationship with your patient, that rapport, showing empathy and understanding and bringing in the patient's perspective. In other words, it's not a textbook case, that's a real patient. So how is an injury or illness affecting the particular patient? That's important. It's your job as a health professional to lead the role play and provide structure. So knowing when to transition from one section, perhaps taking history, then transitioning into explaining a common medical condition or giving education or advice. So it's your job to control the pace. And then there's information gathering, the ability to take a patient history where required, and then information giving, the ability to explain common medical conditions or procedures or give advice. So all of those things are assessed. All good so far? All right, well, let's break it down and we're going to look at some skills, and I'm going to get you guys in the live audience to get a little bit involved here and help me a little bit with the language use. So the first thing you need is a good questioning technique. If you want to get your required score, you just need that ability to take a patient history by asking accurate questions that are clear and concise. Now, that questioning technique is often used at the beginning to establish the reason for presenting, and then it's used throughout the role play whenever you need to gather more information from your patient. So I've created a little framework here, and I've got the topic of pain. A lot of times you'll have a patient who has some degree of pain, and having a good framework to build your own skills and sentence structure is a really good thing you can do. So we've divided it into categories, everyone. The duration of the pain, the site of the pain, the character or the nature of the pain, the time, perhaps when it happens or when it first occurred, the severity of the pain, the cause of the pain, again, the nature, whether it radiates, and relief, what has been done regarding that pain. So to the live audience, I'm going to get you to type in some questions, and I'm going to use this opportunity to check your grammar, everyone, your sentence structure. So let's start with duration, everyone. Can I ask the live audience to type in any questions they would ask regarding the duration of a patient's pain? How would you phrase that? Type it in now, everyone. Jane begins. Well done, Jane. Could you tell me how long you've been, or not quite right, Jane. Jane said, could you tell me how long you've been experienced? No, how long you've been experiencing. Use the ing with your being there, Jane. Amar says, how long are you having this pain? Well, I wouldn't use having here. How long have you had the pain? There you go. Saeed's got it. How long have you had the pain? Sharon, how long have you been in pain is good. Vardeep says, since how long? I wouldn't start with since, just start with how long have you been suffering from the pain? Fahad says, can you tell me how long you had this pain? No, for how long, we have to say, have you had? Hassan, what's the duration of the pain is okay, but it's a little bit rigid for talking to a patient. Keep it simple, everyone. How long have you had the pain? That's what we're looking for. Baron says, for how long? A lot of people want to begin with for how long, but you're better off just to begin with the interrogative. How long have you had the pain? Okay, let's try sight. Everyone, let's everyone have a go with sight. The location. I'll give you a hint. The first word is where. Begin this sentence with where. Begin with where, everyone. While I'm waiting for the first couple of questions to come in, I'll just have a look. Amira had written, how long do you experience this pain? Again, how long have you experienced, Amira? Varbrit writes, where do you feel the pain? Yeah, that's quite good. Where is the pain exactly, Iman? And I've just gone a little bit more detail there. You can say, I've used an embedded question to make it a bit more polite. Can you tell me exactly where the pain is? So that's just a bit of variation. Can you tell me exactly where the pain is? Can you pinpoint the exact location of the pain? That's excellent, Fahad. So he writes, would you please show me exactly where the pain is? Perfect. Sounds like you've got experience in that area, Saeed. Baron says, could you tell me where? No, just word order, Baron. Where the exact location of your pain is. Just put the is at the end of the sentence. Where do you feel pain? Excellent, Rehan. Where is the maximum intensity of the pain, says Hassanin, but that's a little bit overly formal there. That's almost like written English. Hassan, so Adona says, could you please explain where, just remove you, Adona. Could you please explain exactly where the pain is? Okay, character, the type of pain. How would you do this? We're describing, maybe a little hint. Can you use the word describe in a sentence, everyone? Can you use the word describe? Nice and short, everyone. Nice and short. Try to use the word describe. We can also use a yes/no question. Is it a something? What type of pain is it? Can you describe this pain for me? Iman, fantastic. How severe, almost deep, but your word order is wrong. How severe is the pain? Just change your word order there. How could you describe the pain? What kind of pain is it? Can you describe the character of the pain? Very good, Fahad. Can you please describe the pain for me? Excellent, Vardeep. And I've got, can you describe the pain? Or is it a sharp or dull pain? So we can use yes/no questions here. Can be quite effective. All right. And can you describe the nature of the pain? That's perfect, Hassanin. All right, what about time? Time. Time of day. There's lots of options here for time. Lots of different options. Vardeep writes sharp ache. Well, more, not a sharp ache. We'd say sharp pain. We don't normally say sharp ache. Pains can be sharp. Aches are quite often dull. Rehan writes, can you tell me where, well, maybe, can you tell me where the pain is, Rehana? That's the one you want there. Now for time, I'll help you out a little bit here because we've got a few options. How long does it take? That sounds like you're talking about a train trip, Syed. How long does it take? Maybe how long does the pain last is duration. But for time, I've got when do you get the pain, like time of day, or you can ask something more specific depending on the patient's condition. Does it affect your sleep? Does it wake you up during the night? Is it worse when you're standing or worse when you're sitting? It's going to be case by case there. Okay, let's continue. Severity. And I'll give you the first words here. On a scale, I'll give you the beginning. On a scale of 0 to 10 or 1 to 10, on a scale of 0 to 10, can you complete that sentence, everyone? On a scale of 0 to 10. Rabab writes, can you describe the pain? Yeah, that was good for that previous one. On a scale of 1 to 10, how would you describe the pain? Close, Jane, I should say. But instead of describe, I want a different word. On a scale of 0 to 10, how severe, almost Fardeep, just word order, how severe is the pain? All right, and the one that I've got here, on a scale of 1 to 10, how would you rate your pain? So that's a good one to lock into your memory bank. Yes, rate, well done, Sharon. Could you rate your pain? Can you describe the intensity of the pain? Is very good. Saul's got a good one on a scale of 0 to 10. Not how will you, how would you, because it's a little bit, subjunctive there, right? How would you rate the pain? Lots of good ones coming in. Well done, Jalpa, that's good. Can you rate your pain on a scale of 1 to 10? Good. On a pain scale. On a scale of 0 to 10, how severe is the pain? Yeah, and it seems like 0 to 10 and 1 to 10 is pretty interchangeable. I hear a lot of both. Okay, let's continue. What about the cause? The trigger factor, maybe you can use the word trigger here. The trigger factor. Iman says, how would you score this pain? Perhaps how would you rate this pain? Use the word rate. Yep. Common question on the hospital ward or in various locations, isn't it? Okay, we've still got cause, radiation, and relief. We've got 3 more questions to go. So cause, what are you going to do? Maybe you can use the word trigger, everyone. Rana says, can you grade your pain on a scale of 10? Yeah, you could use grade. I think rate's a little bit better, but the next one, Vadeep says, what seems to trigger your pain? Excellent, Vadeep. That's really good. Same with the male. What triggers the pain? And I've got one of my favorites here, beginning with, is there anything? Is there anything that makes it worse? Is there anything that triggers the pain? Is there anything that makes it better? Using that, is there anything, that structure is very effective here. What triggers the pain? Good, Carls. I said, and what do you think, just missing is, what do you think is causing your pain? Does anything in particular, just add preposition in, Syed, is there anything in particular that brings it on? What makes your pain? You can't say more worse, Jalpa, just simply worse. What makes your pain worse? What triggers your pain? Okay, good. What about radiation? But I don't want you to use the word radiate because that's a little bit technical. We can use a more simple language for a patient. Radiation. Does it radiate to other parts of the body? That's perfect, Vardy, but I'm just going to change it rather than radiate, a different word to radiate, please. Does your pain go anywhere? That's not bad, Pat, but we can be a bit more specific. Rather than go, so what I've got is, does it spread? Does it spread to other parts of the body? I guess it depends on the type of pain as well. Does it move down your arm or whatever it may be? Welcome to Panita, who's just joining us. Rehan writes, is your pain radiate? No, does your pain radiate to other parts? Yep. Sarah, does it go to other parts of the body, perhaps, to be more specific? Where else do you feel this pain is good, Amar? All right. And the last one, what about relief, everyone? Relief. You want to know what the patient did before they came to see you. They must have done something beforehand. Yes, that's right, Hassan. Do is better there. Do you feel this pain in other areas? Does it affect other parts of the body? Good, Karis. Just drop the S on the word affect. Does anything make it better? Excellent, Saeed. Does anything make it better? Rub from Egypt, glad you could join us. Well done. Have you tried anything to, almost Jane, but you've used the word relief. Use the verb relieve. Amar's got it. Did you take something to relieve your pain? Excellent. Did you use any pain relief? Is excellent. Is there anything that makes it better, says Rana? Excellent. These are all good sentences. And I've got, have you taken anything to relieve the pain? All right, so everyone, we're just working on pain here, but can you imagine when you're at home to build your skills, change pain and then think of any symptom. You can apply the same framework to headaches, to common coughs, to many different symptoms that your patients get. So if you're having trouble with sentence structure, if this is a difficult activity for you, then set up a little framework, and a really good skill building activity is just to write out those questions and take the time to get that grammar correct. Because often when you write it down and you think about it, you can make that correct structure. Then practice it verbally, orally, just get into that habit. Stand in front of the mirror and start asking those questions. Record yourself and then play it back and check yourself for fluency and pronunciation. Just get into that habit, because you really do need a good questioning technique. All right, so make sure you do that. Okay, let's move on, everyone. So that's our questioning technique. Okay, now let's look at our task itself, the setting. You're going to be given a role play scenario, and they're going to be real life situations that you could face in your workplace as a health professional. And lots of different possible settings. It could be a private practice or suburban clinic for any number of professions that work in those environments, whether it's doctors, nurses, physios, OTs, speech pathologists, and so on. It could be the emergency department of a hospital where patients coming in to get admitted, commonly for doctors and nurses. It could be your local pharmacy or chemist. It could be a radiography practice. You could be a health professional, doctor, nurse, physio, OT, just a few examples, providing a home visit to a patient. You could be in a suburban physiotherapy clinic, a hospital ward, or hospital outpatients clinic, so the patient is on the ward. You could be a community health centre providing support to the community, or it could be a suburban dental clinic. So that's just a few examples of the different settings you'll get. Make sure on exam day that you read your card setting. It will be on the top left-hand corner. So make sure you know where you are. You don't want to be in a hospital ward and then saying to a patient, what brings you here today, when they're already here. So you have to adjust the way you start the role play to the setting that the role play is occurring on or occurring in. And remember, the word role play means you need to act. So you need to be a good actor here. Bring out your acting skills as best you can to make it very real. That's going to make your communication more effective. The interlocutor will be acting as a patient, and you need to act as a health professional in that setting that you're provided. That's the uniqueness of this exam. Iman says, how can I overcome ums and ahs? Good question, Iman. Those hesitations I spoke about before with fluency, I think that's the best way to do that. Two things I'll suggest. One, just record yourself and try to speak smoothly without the ums and ahs, just to get that smooth rhythm. If you concentrate on and work on it, you'll find you can reduce those hesitations, but it's all about practice. It's all about practice. The other good technique is find some actor or someone that you like, whose speaking style you like, and get them up on YouTube, everyone. Find your favorite speaker on the YouTube channel and just watch the way they deliver English. You can start with the Queen of England. She's got a lovely diction, lovely flow, but pick anyone on YouTube and look at their rhythm and flow and try to follow that. Is a good technique. Okay, so let's look at a card, everyone. Well, we will in a sec, but first we'll look at structure. So in terms of role play structure, this is just one example. Every case is different, so they don't all follow the exact same structure. But here's one example. So you start the interview, introduce yourself. Hello, I'm Steve, your doctor. What brings you here today? And then find out the patient's name. You might say, how may I address you? Could you tell me your name, please? That's always good. And then you start by taking perhaps a bit of history, or what brings you here today? What seems to be the problem? And then after that, you're going to follow the patient lead a little bit, see what they say and respond to what your patient is telling you. So there'll be a lot of spontaneous speech here that you can't really completely plan for. You'll be listening actively and responding to what the patient says. At a certain point in time, you are leading the role play, so you're going to need to explain something to the patient, quite commonly a medical condition, or perhaps a particular procedure. It could be giving advice. Perhaps your patient needs reassurance. They've got concerns, they've come to you with a problem. They need some solutions, but also some reassurance that they're doing the right thing. So I think in essence, as health professionals, you are problem solvers. Your patients come to you with problems and you have the expertise and knowledge to help them come up with some solutions. So that's what you need to do. And of course, they need that reassurance. So to show empathy and understanding is also required. And then normally the ending to a role play is fairly short and concise. It could simply be saying, are there any other questions that you have? Something as simple as that. And all the way through, as a health professional, you're providing structure, so leading the role play, and you're also building rapport by using positive language and encouraging your patient to express themselves and to establish some trust in you as a health professional. So that's the framework. And we're going to look at a scenario, but before we do that, I've got Punita with a question. If I was given case notes with brief explanation of main points to discuss the patient, would I need to make my own points? That's a good question. And the simple thing is I'll explain it by looking at this scenario we've got coming up now, Punita. But the OET card, send a card, will give you enough information to give you the basis of your communication. And then it's simply up to you to expand on that, into more detail based on A, what the patient asks you, and 2, what knowledge you bring to the task itself. But it's not a test of your medical knowledge at all or experience. Normally, you just have to expand further on the information given. So here's a case, everyone. This is a case where we are, well, you saw by the previous image, it's eczema, everyone. So we're going to do a case with eczema in a child. This is just an example. Eczema in a child, you can see that on the image. And then you've got the health professional card. We've got our setting. We're in a suburban general practice. And then we've got our card. It says, your patient is a young boy of 5 who is presented with his parent. Now, we don't know the gender of the parent. So if it's a male interlocutor, then you'll be talking to a male. If it's a female interlocutor, it will be a female. Now, the patient has patches of red scaly rash on his hands, back of his knees, and his stomach. The rashes are very itchy, have become cracked and weepy. Physical exam reveals eczema. Parent has tried to ease the itch with various cosmetic creams, but they don't work. So that's the scenario, everyone. You know this patient has had difficulty. You know the condition is eczema. You can use your experience and knowledge here. This task could be common either for a doctor, a pharmacist, or a nurse. All could potentially have a task like this. And then the task itself says, find out what the patient knows about eczema, explain who is affected, explain the causes of eczema. And we've got here soaps, woolen clothes. So it's the tasks will provide you with information and you just need to expand on it. Encourage the patient to monitor the diet of the child and respond to the parent's concerns. So that's the card you'll be getting on exam day, and you'll have 3 minutes to read it, and you'll be taking notes and mentally preparing. A good strategy is to think about what questions you can ask to begin the role play. In real life, if a patient had eczema or the child of a carer had eczema, what would you ask to get details of the condition? Because there is no, this says here, physical exam reveals eczema, but you won't be doing a physical exam in the role play because there will not be any little boy in the room. So you just need to be a little bit creative in the way you do your role play there. This is what you don't see, everyone. This is the patient card. It's more or less a mirror image of the health professional card, but it's from the patient's point of view. And it's very similar here, what the patient has done and their concerns. And then it simply says, ask the health professional about the condition, express concern at the diagnosis. So you know you're going to have a concerned patient. So you're going to have to reassure them. And the patient wants details of the treatment options, which relates to what the information you're going to give. The patient's concerned about the future. And down the bottom, we can see respond to the parent's concern regarding duration of condition. So they are very connected, the two tasks. And my suggestion to you all when you're doing the role plays, spend that 3 minutes preparing for it. But once the role play begins, try not to be too card focused. Look at your patient, listen actively and respond to what they're saying. And try not to paraphrase too much from the card itself. That's a bit of a trap. Sometimes people are trying to read from the card while they're talking, and that can affect your fluency. And if you're not listening actively, you may misunderstand or miss some of the questions asked by the patient. So try to be very patient focused once the role play begins and let your natural instincts take over. But the good news is the card is there all the time to support you. So whenever you're unsure what to say next, you can glance back at your card in the exam and continue speaking. Okay, so that's the card itself. So we've done information gathering. So on this eczema scenario, I want to work on information giving. right? Information giving. So, and we need a good framework for that. You've got to have good structure. So a really common framework is what we're going to look at now. Tell the patient the name of the condition. Find out how much the patient knows. That always gives you a good start point. There's no point explaining a lot of basic information if the patient already knows it. So find out how much they know. Then provide general information. What type of condition is it? Is it a virus, an infection, a disease? Is it a rash? Who gets it? Who is commonly affected by eczema? If it's osteoporosis, who's commonly affected by osteoporosis? You should state that. Talk about the common symptoms and the process of the disease. Moving on, then you might mention the treatment and advice and management, how to deal with this condition, and possibly risks and complications if necessary. So that's a really standard framework, everyone. All right, so let's move on. So here we are, everyone. We've seen this before. So I'm gonna go through this dialogue, and I want you to help me. So I've got a little mini dialogue, everyone. Writing dialogues yourself is a great way to improve your skills because it's going to help you with sentence structure. And it's going to help you anticipate what that patient may ask you. So what I want you to do here, we're making this generic. It just says health professional. And I've got a little gap fill activity. So on the left-hand side, you can see these gap fills and numbers. 1, 2, 3, 4, 5, 6, everyone. I want you to just type in the number for each gap as I call it out. You tell me what number it is, and we'll just fill the gap. So it begins. All right, Mrs. Small, let me have a look at John first. Something, your son has a condition known as eczema. Something. Okay, what number would go first? Based on the gap fills on the left-hand side. Type in the number. Yep. Sayad's got it. Number 3, that's the beginning. Right? So we've already taken the history, remember? We're just working on the explanation now. So, fine. Based on the examination, your son has a condition known as eczema. That's it. What's next? Look at the gap fills on the left-hand side. Number 5. No, it's not number 5. It's not number 2. Saw's got its number 6. Have you ever heard of this condition before? Have you ever heard of this condition before? And the mother says, no, I haven't. What is it? What do you do? Do you say, let me reassure you? Do you say, I totally understand your concern? That wouldn't be right, would it? Do you say it's common in early childhood? Not yet. Getting some numbers coming in. No. Karis has got it. There we go. What? The mother says, no, I haven't. What is it? Well, I'll explain it to you now. And I like that pause, everyone. Instead of going directly, eczema is also, just setting the scene, I'll explain it to you now. That helps with your fluency, everyone, because it gives you an opportunity. You're telling the patient what you're going to do before you do it. So you're preparing the patient for the explanation, and you're also giving yourself time to get ready to explain it. So it's a nice way to communicate. Eczema is also called atopic dermatitis. It's an inflammatory condition that, what do we put here, everyone? It's an inflammatory condition that well done, Sharon. That is number 5. that is common in early childhood. So that's reassuring the mother, isn't it? If you said it's a rare condition, I think the mother in this case would be quite worried. But by just saying it's a common condition, that tends to ease that tension. Mother says, so is it serious? I'm really worried about John. You see that this rash has become cracked and weepy. Okay, we've got to show some compassion here, a little bit of empathy. So to show empathy, what are we going to do? Number one, that's right, Farhad. So we're going to put number one. I totally understand your concern, Mrs. Small. And then the last one, we know what it is, don't we? Let me reassure you that eczema is a self-limiting skin condition. This means that most children will get better after a short period of time, even without any treatment. But of course, with appropriate treatment, the rash will heal more quickly. So that's nice. Just remember that pattern, everyone, to show empathy. I understand your concern. So empathy, and then reassurance. Let me reassure you. So empathy and reassurance. That's a nice pattern, everyone. Okay, let's go to the next page. So the mother says, what treatment do you recommend? Sorry, I'll just move something here. The mother says, what treatment do you recommend? You know, this rash and itchiness have made John feel so uncomfortable. Health professional says, yes, I can see that, Mrs. Small, but don't worry. We have some very effective strategies to help cope with eczema. What goes in now? 1, 2, 3, or 4? While I'm waiting, Dahlia says, are 16-year-olds classed as adults? No, I'd say 16 is teenagers, Dahlia. Perhaps 18 medically, because they don't need to ask for consent after that. Well done, Saw and Rana. So we have some very effective strategies to help cope with eczema. I'd like to explain them to you one by one. Is that okay? Again, we're flagging our question and we're asking a question, is that okay? And that creates interactions. That's a good technique. Mother says yes. All right, now what are we going to put, everyone? The health professional says. Number one, that's right, Jane. Firstly, the rash might be related to an allergy or irritation. So please avoid things that may irritate the skin, like soaps, woolen clothes, and so on. Then we've got to put in another one. Yep, we've got the first one, number one, we've used. And now we're going to use, it's either going to be 4 or 5, isn't it? Number 4 says, Karis, correct. Pay special attention to the food John eats to find out the possible food that may trigger the condition or make it flare up. And then we go for number 5, don't we? It's also important to stop John scratching the rash, as it can make it worse. And then we can end, always a good idea to end with a question. Is that clear? Always check the patient understanding. So that's quite a long sentence, everyone, and that's a really good strategy. Anytime the patient asks you one question, try to give a long response, perhaps a 2 or even better, a 3-sentence response. If you can give a detailed response, then you know you're expanding well and giving a good amount of detail. All right, let's continue. Mother is happy about that. She says, thank you. But what about the future though? I mean, will he grow out of it? What goes in here, everyone? Health professional, something, as I said, eczema is a self-limiting condition. So mother says, I mean, will he grow out of it? Is it the risk is very low? That's a good question. Or run in the family. Yes, well done, Apple. It's number 2, isn't it? That's a good question. Now let me ask you people in the audience, do you use this sentence ever? Do you ever use that when you're talking to your patients? That's a good question. That's a good question. It's a very good question to ask because it lets the patient feel comfortable that they can ask, that there is no bad question, that they're in a supportive environment. So it's good to tell them that. That's a good question, or I'm glad you asked. Rana says no. All right, we'll try it again in the future, Rana. It's a good technique, very common. That's a good question. As I said, eczema is a self-limiting condition. When the skin becomes more mature, this condition will heal and no longer be a problem. Mother says, what about John's brothers and sisters? Are they likely to suffer from the same condition? Health professional says, well, it's possible because eczema does run in the family. Thank you, Saeed. And Kath, run in the family. Well done, Renan. I'm glad you do ask. If one child has eczema, then his brothers or sisters may be more likely to suffer from eczema than other children. But it's nothing to get alarmed about. The risk is very low. Okay, now that's a sample dialogue, everyone. And this is something that you can do at home. A really good technique to build your skills is to sit at home, get a case note scenario, and imagine what the patient would ask you and imagine how you would respond and write out that dialogue. And then practice that dialogue. Again, record yourself. We all have phones now, smartphones that we can use to record ourselves and play it back. Just that repetition is a really good thing to do. Okay, I'm moving right along. We're going to look at responding to a patient and incorporating their experience with reassurance and empathy. So we've done gathering information, taking a patient history, we've done explaining common medical conditions, and now we're going to look a little bit at empathy and reassurance, and in particular, I want to just demonstrate a little active listening technique, everyone. A little bit of active listening. So it's really good if you can demonstrate that you're a good listener. Being a good listener is part of this exam because you have to listen to what your patients are saying, right? Every patient is unique, so you need to listen. So here's a little technique that demonstrates that. What we're going to call an echoing technique. You can take some of what the patient said, and incorporate that into your own sentence. So imagine this, everyone. Look at this image. The patient has this pain in their neck and back, shoulders here. And the patient says, I can't sit for long periods anymore. I can't sit for long periods at work anymore. The pain in my neck and shoulders is really bad. How will the health professional respond? Well, what you can do is this. If it's affecting your work, we need to address that. You said that you can't sit for long periods of time at work. Is the pain affecting other areas of your life? So this is good skills because the health professional has picked up the work and linked to it. As soon as you do that, you're really demonstrating that you're listening and you're responding. It's not a pre-planned, it's really good active listening. Let me ask the audience, do you do that when you listen? Is that something you're doing now when you hear a patient communicate in English? Are you incorporating what they say into your responses? Let's try another one. My father had a stroke at 55, and I'm worried the same thing could happen to me. How can we incorporate that? Let's try it. I can see why you're concerned. Okay, I can see why you're concerned because the patient said they were worried. So we've linked straight to that, and we've used a synonym, concern. Although strokes can be hereditary, hereditary is summarizing the patient's concern about it running in the family. Although strokes can be hereditary, it doesn't mean you will get it. Changes to your lifestyle can help prevent this happening to you. Have you considered improving your diet or doing regular exercise? So again, we're linking to it. All right, and the last one, I'll leave it up to the audience, everyone. See if you can come up with a respond and incorporate something that the patient says. We've got some good images, healthy food, active walking. And it says here, the patient says, you said I need to change my diet and do more exercise. I can't do that. It's too hard. How would you respond to that? All right, and Vardeep's written, I can understand how hard it is for you to sit for long periods when you have pain in your neck. That's excellent, Vardeep. Rehana says, I can see your concern, or I can understand what you mean. That's nice. All right, and try to find some specific phrase that relates to what the patient said. And I will say, everyone, this is quite a high order skill. So you really got to practice this one because you're paraphrasing. Paraphrasing can be challenging. So it's a really good technique to work on, to focus on that active listening. If you're going for a high score, everyone, B or even an A, if you're going for an A, really try to demonstrate your active listening because it does allow you to really focus on what that patient is saying and demonstrate that you're listening and understanding. Sayad writes, I can see changing diet and doing exercise are difficult at the beginning. Good, Sayed. Rana says, I can understand that big changes are difficult. You can do it gradually. That's the way, Rana. Nice work. All right, and I'll see what I've got here, everyone. The same sort of pattern. It's difficult at first to make lifestyle changes. So I've summarized it with lifestyle changes. It's difficult at first to make lifestyle changes, but it is important for your overall health. So remember, you can show empathy, but then you use the word but, and you remain strong because you know what's best, because you're the health professional. But it is important for your overall health. Try gradually reducing your fast food intake and introducing healthy foods into your diet. In terms of exercise, try to get at least 30 minutes of exercise per day. Start by going for walks every day. Do you think you can do that? So always try to give specific advice as well. It makes it a lot more real if your advice is specific, such as duration of exercise. And the last sentence, do you think you can do that, puts it on the patient to take responsibility for their own future health, which is something that independency that you're striving for your patient. Okay, and some good sentences coming in. I know how you might feel. I like that, buddy. Start with small changes. That's good. Shelley writes, I know it can be a bit difficult for you, but it will be beneficial for your health. Good. And I can understand it's really hard to change your lifestyle, says Sharon. In order to attain and maintain your health, it is necessary. All right, so practice that, everyone. That's good skills. And some final tips, everyone. So we've just gone through some basics, everyone, for the speaking and what you can do to enhance your communication. And lastly, I would just say, control what you can control. So that means 50% of the role play you can control because you're leading the role play. And then all that work that you do to learn the patterns necessary to take a patient history and to explain common medical conditions, that's what you're doing at home, building your skills. And of course, the other 50%, you're going to have to respond spontaneously to what the patient says. So you need to be aware of that and develop your skills at responding. And the more you practice, the more natural that will become. Another tip, expand on the information. For every question the patient asks, try to respond with 2 or 3 sentences. Get used to expanding and giving reasons and examples of what you want them to do. So that 2 to 3 sentence response is very good for your technique. Lastly, be patient-centered. The patient is real, so use the background information or in the scenario given to help you address the needs of that patient. A common mistake that people make is they don't read the card carefully. There's useful information that you can use to make that role play more effective. You just need to locate it and use it in your role play so that the context is correct.